Cecile Richards, president of Planned Parenthood Federation of America, joins us now from Washington. Thank you so much for your time.
Absolutely. Good to be with you.
So certainly Planned Parenthood is not the only organization that the Trump administration has talked about defunding, and there are groups in Colorado, from arts organizations to public broadcasting, that tell us that they've prepared for this loss of federal funding. Does Planned Parenthood have a similar contingency to operate without federal funding?
Well, we're, of course, making all the plans we need to protect access to health care for women. I think the difference is what they're talking about doing. Of course, we don't get a check from the federal government, so we're in a different situation. We're not in the federal budget. Basically, what this bill before Congress includes is that women who come to Planned Parenthood now under Medicaid would no longer be able to come to us for preventive health care. So it's about money, but it's really about access as well. And the big concern is we see tens of thousands of people in the state of Colorado, many women who rely on us as their only health care provider, and their health care is really what is at risk.
So the Republicans who are driving this are opposed to abortion rights, and we should know that Planned Parenthood by law is not allowed to use its federal funding to perform abortions except in a few rare circumstances. Do you think that defunding Planned Parenthood would actually accomplish conservatives' goal and greatly reduce the number of abortions that Planned Parenthood provides?
Well, actually, what I fear is just the opposite. And one thing is really important. Planned Parenthood operates just like other hospitals and healthcare providers that provide abortion services. We don't get federal funding, as you said. We get reimbursed for preventive health care. And the vast majority of that care is actually preventive care, birth control, that helps prevent unintended pregnancy and the need for abortion. So, and what we've seen in other states where they've tried to end access to family planning and birth control is that, in fact, of course, the unintended pregnancy rates have gone up. And that's a big concern of ours. We're so proud that under the Affordable Care Act, 55 million women now have access to birth control with no copay. We've seen a record low in teenage pregnancy in America and a 30-year low for unintended pregnancy among women. The thing that is really disturbing about this bill and why I think so many women are opposed to this bill is it would mean ending access to preventive health care. Again, not only at Planned Parenthood, but it would threaten access to birth control across the country.
I guess what I'm trying to get at, though, is that the conservatives think that while Planned Parenthood is not allowed to use those federal funds under the Hyde Amendment for abortions, they think that the organization is basically propped up by this federal funding. And is that not what we saw in Texas, which you alluded to, where the state severely constricted funding, is that what happened was that fewer women had access to abortion when the money for these other services was taken away?
Actually, it was just the opposite. What happened in Texas, and we are still operating in Texas, but what happened in Texas is actually women lost access to birth control. In fact, there have been academic studies that have reported not only an end of access to birth control and the best forms of birth control, which you all know a lot about in Colorado. There's been such an important work done there by the governor and others to make sure women had access to birth control. So in Texas, not only did women lose access to birth control, but we actually saw a doubling in maternal mortality rates in the state of Texas because women had less access to preventive care. And that is really the irony here, is that if you cut off access to birth control and you cut off access to the only health care provider for some women that provides family planning, all you're going to do is raise unintended pregnancy rates, and that's what we're trying to prevent.
What would practically happen in Colorado if Planned Parenthood was defunded? There's about 100,000 people that get care at your clinics here each year. So if those 21 Planned Parenthood clinics lost the federal funding, there are 200 plus federally qualified health clinics of various sorts around the state. You don't think they'd be able to fill the need in the system?
You know, it's been really interesting because I know that's been a talking point by the Republican leadership in Congress. But in fact, the community health centers and the communities have been very, very clear. We work closely with the rest of the public health community, and many times they refer women to Planned Parenthood because they can't see them in time, not only for birth control, but we see women for breast cancer screenings and for pap smears. And I've talked to so many women who are patients of Planned Parenthood who found a lump in their breast. They couldn't get an appointment anywhere else in time. Planned Parenthood was able to see them that day or the next day, and it was because of that they got early treatment. And many of these women now are cancer-free, and they're here lobbying Congress saying, do not take away our access to preventive health care. We're strong supporters of the community health centers. They're strong supporters of ours. They're saying we simply cannot absorb the 2.5 million patients that Planned Parenthood currently sees.
And a final quick question about Supreme Court nominee Neil Gorsuch, who's from Colorado. You've said that anyone who opposes the pro-choice ruling in Roe v. Wade is not qualified to sit on the court. And Judge Gorsuch hasn't really ruled on abortion. Now, Planned Parenthood has said that no history of support for the finding in Roe means that Gorsuch should not be on the court. So is that the new benchmark? It's just that a judge can't be hostile to Roe, but a judge with no favorable rulings toward abortion rights is similarly disqualified from the Supreme Court?
Well, actually, Judge Gorsuch has some very disturbing rulings from the bench on basic access to birth control, which I think is even more alarming in a way. He, of course, sided in the state of Utah with folks who wanted to prevent access to family planning services at Planned Parenthood in the famous or infamous Hobby Lobby case, which was a case about allowing employers and bosses to decide whether or not women could have access to birth control. He supported that decision as well. What we're simply saying is women's access to birth control, we've had it for more than half a century. Women's access to safe and legal abortion is something as well that is established law. These are disturbing rulings by the judge. And of course, President Trump has said he's only going to appoint nominees that support overturning Roe versus Wade. And we simply think that this is a right that women have had in this country for a long, long time, and women do not want to go back.
Cecile Richards, president of the Planned Parenthood Federation of America, thank you so much for your time this afternoon.
Thanks for having me.